We're at the Pharisee Clinic in Windsor Heights again, and Dr. Joe and I are going to continue our discussion about headaches. We're going to talk about the different kinds of headaches and how to treat them. Dr. Joe, it's great to see you again. Every time I'm with you, I feel like I learn so much. You are incredibly knowledgeable.
Thank you very much.
You've told me a little bit about migraines and tension headaches, and I know you mentioned something about a drug rebound headache. Is that correct?
That is correct.
Can you tell me a little bit about what type of headache that is?
Yeah, this is something that's really come up on the radar in the last 10 years or so. And what they found is that drugs that are commonly used to treat headaches, patients can actually become dependent on those. They can change your body's chemistry and then actually themselves cause headaches. And there's no one drug that does this. It could be Aleve, Advil, aspirin. It could be prescription medication, even the opiates, the narcotic type of drugs. And what happens is you get a headache, you take the drug. It works.
Yes.
Then what happens is your body starts to recognize that this drug is coming in and it makes corrections in your chemistry. And so it begins to become less and less effective. But then when you stop taking it, and caffeine is another one that we see, caffeine withdrawal headaches are a type of rebound, that when you stop, suddenly these chemicals or the changed body chemistry is there and you get the headache.
Dr. Joe, you mentioned that people are on these drugs for maybe a long period of time. What would be the definition of a long period of time?
I would say months. Okay. Once we've gotten past, if you're starting to take it regularly for months, you're probably going to fall into where it can alter your body's chemistry. If a person gets an occasional headache and takes an Aleve or Advil and it goes away and they don't take it very often, there's really no issue with that.
And then do you treat drug rebound headaches?
Yeah, we do.
Okay.
Obviously, one of the things to do is, it's like detox. You just have to withdraw the substance.
Okay.
And so during that period of withdrawal, patients do tend to get a lot of headaches. And so we need to use non-medication treatments for their headaches in between. And that's usually, again, goes back to the chiropractic treatment that we discussed earlier.
Dr. Joe, how often does somebody need to be treated when they have a headache?
Well, whether it's headache or even another sort of condition, neck pain, back pain, any of the things, it's very, very variable.
Okay.
Some people respond extremely quickly to treatment and don't need a lot of treatment. And younger people that don't have a lot of degenerative changes in their joints tend not to need a lot of treatment. What we do here is we take it one day at a time. We measure how you did from last time, and we try and tailor it to you. Now, my job is to recommend to you what I believe is the best for you.
Sure.
But occasionally, people have actual lives, and that gets in the way of them getting all the treatment that might be appropriate. So we're here for our patients when they need us.
Sure. And I do have a quick question for you. I mean, I don't feel any back pains and headaches. If I don't get anything like that, do you think I need to see a chiropractor? Would it be good just for my general overall wellness and health?
That is actually a very controversial question. My personal opinion is yes. An occasional visit, just like getting an occasional massage even or something, is probably going to be good for your overall health.
Just to prevent anything that could potentially...
Correct,
Sure.
Absolutely. Personally, in this office, we don't do a lot of that sort of what's termed maintenance care.
Okay.
But I have nothing against it. It's just not something that I do in my office.
Great. Well, Dr. Joe, thank you so much for your time today. I'm sure our viewers are going to learn so much about headaches and prevention and treatment. Thank you.
Thanks again.
Stop in and see Dr. Joe, or for more information, give him a call or visit his website, phariseclinic.com.